thank you very much for having me here. This was obviously last minute, so I tried to throw some things together in a hurry. And then, of course, the computer program decided to quit partway through, so I had to redo it. So sorry I'm late. So yeah, as she said, I'm with Buckeye Veterinary Service. I graduated in '91. I've been in the area since, and we see a little bit of everything. We do a little bit of everything except a major surgery. So we're ambulatory. We have a nice practice with the building and a new indoor that's up that the footing's coming soon. So if you don't have a place to do lameness exams, very soon you'll be able to come to our practice in Burton, and we'll have a nice indoor arena where we can do that sort of thing and get it all taken care of. You know, we have all the fun things: digital x-ray, digital ultrasound. We can do PRPs and shockwave therapies and IRAPs and all that kind of stuff. So, so this is supposed to be about deworming. And just very quickly, so what I'm gonna try to tell you is what the major worms are that we're dealing with, the academics' perspective on what we're supposed to do, what we've done for years, and how those two may intersect. So the first thing is what the academics are telling us that we should be doing. What we know is that parasites are developing resistance to the anthelminthics that we have in the world today. There's really no new dewormers in the pipeline as far as I know. There's nothing new coming out. So we're stuck with the few that we have as of right now. And what the academics are telling us is that they finally realize that we're deworming too often. And what they're suggesting that we do is fecal exams on a relatively regular basis. So I can give you their concept, and then we'll talk about the things that we're doing. So they want us to do fecal exams 3 or 4 times a year on these horses. Many of these horses will come back clean. We're looking at eggs per gram. So basically a gram is about, it's just a small amount. We don't weigh it anymore. We just kind of take a pinch of the fecal material and assume it's about a gram. And then we put it in in a specific solution and get it on the slide and look at it on the slide under the microscope. These are strongyle eggs. This is an ascarid egg. These are the most common things that you're going to see on a fecal flotation. This is our in-house laboratory. Oh, sorry, wait, that's not it. This is our in-house laboratory. This is Kelly. She loves doing fecal exams. There's something wrong with her. So, but she's very, that is not supposed to say in-ho. That's supposed to say in-house lab. So what they want you to do is to do these fecal exams, and then you're supposed to identify horses as heavy shedders, moderate shedders, light shedders, because all these horses are going to have a different response to the parasites. Some of them that have a great immune response to them, have seen a lot of them. Maybe middle-aged horses that have been exposed to many of them will not have very many parasites. Okay, so those horses theoretically don't need to be wormed as often as a horse that doesn't have a very good immune system, hasn't developed a very good response to those parasites, and will have a lot of eggs per gram coming out. So in our practice, at least, what we look at, and I don't know that there's hard and fast numbers, what we kind of decided to settle on is when we run fecal exams is we look for less than 100 eggs per gram, and if there's less than 100 eggs per gram, we're usually okay with that, depending on the worming program. So, no, you can't see that very well, I'm sorry. These are bots. This is from our gastroscope at our office. So we're actually in the stomach looking at the stomach lining, and these are actual bots. So you guys know about the bots with the bot flies. They lay those lovely yellow eggs on the insides of their legs. Those are supposed to hatch into a larval stage that actually crawls into the horse's mouth and then works its way into the stomach and then forms these lovely parasites that are in the stomach itself. So there are only a couple of things that actually kill bots, and we do not see these on fecal flotations. So we just routinely deworm for the bots. So these are ascarids. These are roundworms or bloodworms. They're fairly large worms. Most of the time, if you're going to see these in a fecal, in an actual pile of feces, it's going to be in young horses that have been recently dewormed. older horses in most cases have developed a reasonably good immunity towards ascarids. So ascarids are not our huge primary problem. These are tapeworms. These are, again, can't see it very well, I'm sorry about that. These are segmented worms. They are also not necessarily killed by every anthelminthic that we have, any dewormer that we have. These can be a problem with, especially like yearlings is where we see these a lot, and they actually can get where the ilium and the cecum attach, and they can cause blockages there or potentially cause enough damage that you actually get what's called an intussusception, where part of the intestine will work its way into the other intestine, kind of telescope in, and then that's not good. So these things can cause a lot of damage as well. These guys don't release eggs that are typically found on a fecal flotation either. They release kind of a packet with eggs. So bots and tapeworms you do not necessarily see on a fecal float. These are strongyles. The large and small strongyles are typically the ones that are going to be causing problems. The small strongyles are the ones that we're looking at the most often. And lots of horses will have these even as they age. So we see less and less ascarids as horses get into maturity, and we continue to see strongyles depending on their worming program. And then last but not least are pinworms. This is a pinworm in a pile of manure. Pinworms are the ones that actually children and people can get them too, not necessarily from horses, but they will actually live in the small colon, and they'll come out of the rectum at night and lay the eggs around the perineum. So these horses will potentially be itchy on their butts. They'll rub their tails, and I've never done this, but theoretically you can take tape, Scotch tape, and find the eggs on the back end of these guys and look at them under a microscope. Children have these very commonly, and sometimes you have to push your actual medical doctor to treat these. One of my kids had them, and basically we use the same drug. It's pyrantel, it's Strongid, and everybody in the house has to take them. Take the Strongid and get rid of them because you potentially pass them around back and forth. So very common thing even in people with the pinworms. So right now we really have, in my opinion, we have 4 dewormers that are very useful. So I'll tell you what we do. We have wellness programs. We have 2 different wellness programs that are kind of prepaid deals that we come to the client's house twice a year for the pleasure program and 4 times a year for the performance program. And what we've done with that, we incorporated fecal exams twice a year into that program for a couple of reasons. 1, as a service to the client so we could see what we had. 2, as we were doing only 1. We were doing 1 in the spring, and then after the first year we started running 2 of them just so we could see how we were doing with the deworming program. So we run fecals on these horses twice a year. And the horses that are on the wellness programs have a set schedule. Part of the problem that has caused our problem with resistance is over deworming. So these horses, in my opinion, normal adult horses, do not need to be dewormed more than every 3 months. Okay? There are a lot of horses that probably don't need to be dewormed that often. So if they're getting dewormed more and more and more often than that, we're probably just creating resistance. So we run a fecal on these horses, and we have a lot of horses in the program. I don't know how many, but we have a lot of horses in the program. They get dewormed 4 times a year, every 3 months, and we do a rotational dewormer. And the vast majority of those horses on our fecal exams come back clean, like no eggs per gram. So I think it's successful, I think it works, and when I've talked to the people who are promoting doing the fecals and worming the horses appropriately, and I say, this is our program and our horses typically come back clean, am I supposed to change it? If it seems to be working, they have told me no. So, I'll tell you what we do here in a second. So this is Panicure, this is fenbendazole. This is also, this is what we use in the spring, typically. There's not necessarily a hard and fast rule that it has to be used in the spring, but that's the way that we've set up our program. So we usually use a panicure in the spring. It's still a pretty good wormer. There are some horses that do have strongyles that are resistant to this. This is also what you use the Panicure Power Pack for. And the Panicure Power Pack is 5 days double dose of this, and it comes in its own container. So you basically it's 2 of these every day. And that is supposed to kill the encysted small strongyles that end up in the gut and can cause problems when they uninsist. There's only one other thing that treats those, and we'll talk about that here in a couple of minutes. So the problem is that if I have horses that are resistant to Panicure, that have strongyles that are resistant to Panicure, they're also resistant to a Panicure Power Pack. So if they're resistant to 1 tube of this, they're resistant to double dose times 5 days. Okay, does that make sense? Because I've tried it and it doesn't work. And what I was going to say about the horses that we check the fecals on, most of the horses that are in our area, that have been in our area, that have been on our program, come back clean on our schedule. The ones, and this is a gross generalization, but the ones that I have that come back most of the time with resistant parasites are usually not from here. So they have come from wherever, if they've come from out west or they've come from Florida or whatever. And so I'll have clients that have 2 horses that they've owned, they've been here for years, and those horses come back clean, and they might have a newer horse that's come in within the last year, and that horse may very well have a large number of parasites. Okay, a large number typically of strongyles. So it's interesting, and it may be that we don't have quite as much resistance as other places have yet, but this is the dewormer that we typically use in the spring. Strongid is Pyrantel, and again there are off brands of these as well that should be effective. These are the brand names that most people are familiar with. So Strongid is Pyrantel. It still works pretty well as well. Obviously there's some resistance to all of these things, but Strongid works pretty well as well. If you use a double dose of Strongid, it's very safe, very, very safe. If you use a double dose of this, that will kill tapeworms as well. So when my son had a problem with pinworms, and it'll kill pinworms. When he had a problem with pinworms, we all had Strongid liquid that we were using to tube worm horses with, and so we all took the Strongid to get rid of the pinworms. So this should kill pinworms and tapeworms, but you have to double dose this to kill tapeworms. Okay, this is what we use in the fall. Again, no hard and fast rule with that. This product is Equimax. It's a combination product. It has ivermectin and praziquantel in it. So ivermectin is still very effective. It's one of the newer dewormers, and as you all know, it's been around for a long, long time. So it's still effective. When I was in veterinary school, they were having resistance to, the first time that I had heard about resistance to ivermectin was in New Zealand with sheep. But they were already having resistance problems in the late 80s with ivermectin. Still a very good dewormer, and we use this in the summer, and we use it again in the winter after a heavy frost. And the reason that we use it after, this is my only hard and fast rule with dewormers, is after the heavy frost, when you've killed the bot flies, we use an ivermectin product. Okay, that will kill the bots. It'll also kill the vast majority of everything else in most cases. So we use this after a heavy frost. We also use it in the summer when the horses are out more often and they've been exposed to more other horses most of the time if they're showing. This product has praziquantel in it, which is, if you guys have small animals and you've had tapeworm problems, that is the drug called Droncit that you would get for dogs and cats, or Drontal. That has been put in combination with the ivermectin, so it kills tapeworms. So this is a nice product. It's a nice combination. I think it works very well. Again, there's another company that makes a very similar product, and it's probably fine. This is the one that we use routinely. What else? So those are the 3 that we use routinely. So what we do is we do Panicure in the spring. We do Equimax in the summer. We do Strongid in the fall and Equimax again in the wintertime. And then if we have problems, if we have horses that are chronic problems that, that I've taken fecals on and they've come back with a lot of strongile eggs, which is typically what we see if we're going to have a problem. Most of the time what I do with them is use ivermectin on them first and then recheck a fecal in 2 weeks. And if the parasites are still there or if we've had a significant problem, we'll go to the Quest. So I don't use Quest routinely because I'm trying to save it. I don't think that's a generally necessarily accepted practice, but that's what we've done. And it only makes sense to me. This is the newest drug that we have, the moxidectin. I have not seen resistance to this yet, although I suppose there probably is some somewhere. It's related to ivermectin. So there's a reasonable chance that when ivermectin doesn't work, that this won't be too far behind it as becoming a problem. But so far, this kills pretty much everything. And this will kill the encysted small strongyles as well. So I keep this in reserve. I don't even have very much of this on the shelves in my practice. I think it's a good product. It scared the crap out of people when it first came out because there were a bunch of reports. You're not supposed to give it to foals less than 6 months of age. There were reports of horses that had this dramatic kill and then colicked, and a dramatic kill of parasites and then colicked. What I've seen in real practice with it is I haven't had any problems with it at all, but you do have to follow the label instructions. You don't want to give it to babies. You can potentially have neurologic problems with it. But I think it's a very good dewormer, but I'm saving it. So if things don't work, this is what I go to as a last resort. So the other things to be aware of, because I think this is probably my last slide, the other things to be aware of when we were in veterinary school, one of the things that they talked about that was very important that we thought was kind of over the top was a vacuum to go suck up the manure or clean your pastures, because most of these things are transferred from, it's a fecal oral transmission. They excrete the eggs and you pick up the eggs and then the eggs populate the gut with parasites. So the only one that isn't that way is the tapeworms, which have a little more complicated life cycle. If you really want to get into some interesting reading, check out some life cycles of tapeworms because some of them are just unbelievable what they have to go through and you wonder how they ever end up in an animal on the other end. But they're very well designed for what they do. So I already forgot what I was talking about. So cleaning up the manure. Obvious cleaning up the manure so that if it's not there, it doesn't have the opportunity to transfer the parasites to the horses that are there. The other thought has been over the years is that if it is cold, that you potentially will kill the parasite eggs. And I think it was more demonstrated that if it's hot and dry, if you spread the manure out, that you're much more likely to kill the parasites than you are to freeze them. So having it exposed to the sun and spread out is better than not, but having it gone is probably the best thing. So in school, the doctor that was teaching the parasitology class had a vacuum, and they had a big vacuum on the back of the truck or on the back of the tractor, and you can see these online where they go out and just vacuum up all the fecal material. And I'm wondering how many backyard horse owners are going to be able to go buy a vacuum, but it does make sense. Babies are a little different. Foals are a little different. And I start out usually, personally, I usually start out with Strongid. I think it's mild, but I don't usually give them any dewormer for a while, usually until they're at least a couple months old. Mares, there's always a question about what do we do with the pregnant mare? I don't like to do anything that's overly aggressive, even if it's mildly aggressive to a pregnant mare until after she's had the baby. So usually what we'll do is they'll get ivermectin before they're bred. And then if they need something in the meantime, they'll get Strongid or Panicure, which are probably less aggressive. And then on the day that the baby is born, typically we will give them an ivermectin paste because they can potentially pass strongyloides through the udder into the milk that babies can get. So usually on the day the baby's born, we give them a dose of ivermectin as well. and that should take care of the vast majority of everything else. There was discussion a long time ago about ivermectin in pregnant mares causing some problems. I don't really think that's the case, but I don't do it, I just don't take that chance. I know lots of people that do, and I don't think there's necessarily an issue with it. So, I know that was kind of a whirlwind, but yes? It's a good question. Yeah, you can sometimes see the segments. You can sometimes, occasionally, those fecal, they have like a packet with eggs inside of it. It's kind of a clear packet with eggs inside of it. That's what's excreted in a lot of cases. You'll see that on a fecal float rarely. So in most cases, I just go ahead and make sure that they get the praziquantel product at least once a year to get rid of the tapeworms. Because again, there's things that you just can't see on a relatively normal, just a regular fecal flotation. You don't see bots, you don't see tapes, you don't see pinworms. Now, if you do, again, the academics talking about this want you to do these fecal exams, and one of the things that they say is, because I go pick up a turd in the stall, right, and we take it back, and then Kelly takes off a pinch and sets up her flotation. We actually centrifuge them. It helps the fecal matter go to the bottom and the eggs come to the top, and then you put the slide on the top and look at it. You need a specific solution to do that with. Some people don't centrifuge them. The centrifugication, I just made that word up. Probably what it's supposed to do is accentuate your end result. So if you have, few eggs in it, you should be able to see them. There's a specific flotation solution that you're supposed to use. You can use, there's some people that will use a sugar solution, and then there's another one that we use routinely, but if it's too much, it'll actually rupture the eggs and you won't see them. So you need a specific solution. All right, I lost my train of thought again. Tapeworms. Oh yes, so what they suggested was that you don't just go into the stall and pick up a turd, that you actually put a sleeve on and go in rectally to get the turd, and then as you come out, you have potentially the pinworm eggs on your sleeve, so you can potentially, look, that's way too much. I mean, most horses are not just going to stand there and let you go in for, and most clients are going to look at you like you've got a third head somewhere growing out of you. So practicality to me says if you have a concern about overworming, then check your fecals and see what they look like. And if your fecals come back with very few fecal eggs per gram, then you don't have to worm them as often. The suggestion, again, from the academics is if they're high shedders, they get done 4 times a year, more or less like what we're talking about. If they're medium shedders, they get done 3 times a year. And if they're light shedders, they get done twice a year. But most of the time what they're talking about is only ivermectin product, and I still think that we can use I think if we just continue to use this by itself, we're going to have resistance problems too. So I still like our rotation. And if I can climb up on a soapbox, part of the problem is that we used to be able to deworm horses ourselves as veterinarians. We would tube worm these horses, and we would put the appropriate amount of stuff in a can, and we would use the appropriate wormer for what we thought they needed, and we used a mixture of a couple things for a long time, and we would put the stomach tube in the horse's nose and into his stomach and run the stuff in, and they were done. Then the marketing stuff happened, and suddenly the owners, no offense, could go get whatever, and they weren't necessarily looking at what time of the year it was, what kind of thing do we need, and they were packaged as multiple times a year, and if you read the labels would say every 6 weeks, which was too much on some of them. So not that we wouldn't have had resistance because it was already developing, but it just became, it flooded the market, and everybody was just giving dewormers willy-nilly. So they don't need that much deworming in most cases. And the other thing that's interesting is you'll see horses that are heavy shedders that have a lot of eggs per gram, and they may be fat and healthy and happy. And then you get people that are very concerned when they come back with 15 eggs per gram, which I said we don't worry about them if they're less than 100. It's like a few parasites in that horse is no big deal. So don't necessarily have to have them perfectly crystal clean. The other thing to keep in mind that throws a wrench into some of the fecal egg counts is you can have one parasite that is very productive and will release thousands of eggs at once or in a time period. That doesn't, just because you have a sky-high number, doesn't necessarily mean that you have a gazillion parasites in your horse. So, you know, I think if you want to do the fecal egg counts, there's nothing wrong with it. I think it's very interesting, and you can kind of qualify your program to what you're seeing. And if you have a lot of high egg counts, you go towards an Equimax or a Quest maybe a little more often. But if your egg counts are low, you can probably back off on the number of times that you deworm a year, or go to every 3-month cycle and have them checked every once in a while and make sure they're clean. You may have one female that is releasing a whole lot of eggs, or you may have a whole lot of worms that are releasing a few number of eggs, or you may have a whole lot of worms that are not releasing eggs. The diatomaceous earth is a question. Diatomaceous earth has been espoused as a treatment, as a deworming treatment, and the concept, as far as what I've read, is that it is, help me if I'm wrong, but it's sharp particles, right? It's a bunch of sharp particles, and part of the concept is that it will damage the worms as it goes past them. Well, if it's damaging the worms as it goes past them, it's cutting the hell out of the intestinal tract as well. So it doesn't work. There's been no clinical evidence ever. It's one of those things that's been out there for a long, long time. It doesn't work. Tobacco doesn't work. Strongid 2X, Strongid C. My problem with years ago, the drug rep wanted to ride with me because he was trying to push Strongid 2X when it first came out. And I said, I'll listen to you, but I already have a problem with it. I mean, we're giving them a smaller dose on a daily basis, and we already have resistance problems. So why would I want to do that? Strongid was a good wormer, and it's, you know, it's still a pretty good wormer, but we're using it in that respect. I think we're gaining more resistance too easily. So I don't recommend Strongid 2X unless I've got a horse that I think has a problem. So I have used it for sure on horses that have chronic colics. Maybe on horses with diarrhea sometimes, but and some of those horses do really well on it. If you're in a situation where you're in a private barn with no horses in or out, and you want to put them on a daily dewormer, and you're checking fecals to make sure that it's working, it's probably fine. But as a general concept to me, to have it out there with everybody using it, I think it's a bad idea. Not for the horse, but for 20 years down the road when Strongid may not work. I use Panicure in the spring, I use Equimax in the summer, I use Strongid in the fall, and Equimax again in the winter after a heavy frost. That's what I routinely do every 3 months. Again, I don't think that's overkill. Some horses may not need that, but that's kind of a standard rotation that I recommend. If you're not going to do fecal exams, that's probably the way that I would go. And again, remember, as horses age, their immune system goes down. So people are like, well, my horse is 20, I don't want to vaccinate him, I don't want to worm him. Well, remember, their immune systems get worse as they age. So if they do have an immunity to ascarids and strongyles, it may not be as good as it was. So vaccinating and deworming older horses is still a very important thing to do. Yes?
So you get a fecal test twice a year, and both times for like 5 years it's been negative, and you deworm the horse once a year with Equine. Is that enough?
Yeah, you're probably okay. You're taking care of your tapes. You're probably taking care of your pinworms. Excuse me. It's probably enough, especially if he's isolated, right? If he's not seen a bunch of other horses, if there aren't other horses coming in and off the property, and he's not going other places. Because whenever they go someplace else, you don't know what they're going to pick up. And, you know, the manure's carried on boots, it's carried on my clothes, it's carried on my arm a lot of times. So, you know, just consider where those things are coming from and the possibility of your horses being exposed to other things. Probably not very high possibility to pick up parasites unless you've got horse fecal material someplace around. Again, the other thing is with the tapeworms, those go through a mite stage. So the mites are found in the feed and in the hay and whatever. So those things potentially, I suppose, someplace else. But if you're cleaning up your manure, but here's the story though. I have good clients that have 2 horses. One came from out west, and he's loaded with strongyles, and he's the one that we did the Panicure Power Pack on, and it didn't work. And then, again, when I talked to the academics, they said, well, if the one doesn't work, 2 times the dose for 5 days isn't going to work either. They literally clean up all the manure every day. So, and that horse was loaded, and we got rid of him with Equimax and Quest. And then the following year, you know, we keep checking the fecals. He came back loaded again. So where's he picking them up? I mean, there's someplace, or is he getting to those fecal balls before they get them cleaned up? I mean, every day they literally, the place is really clean. They go out into the paddock and the pasture and take it all up every day. They're crazy. But, you know, it's great. It's great for the horses. But again, when you look at this horse, he's not a skinny, poor-looking, no top line, bad hair coat horse. He looks fine, but when we do a fecal on him, he usually has some strongyle eggs, and then when we come back with Equimax or Quest, they're gone for the most part, but by the time we come back to him again, he's got more parasites. He does not have a good immune system to kill them and get rid of them. Yes?
You mentioned the double dose of Strongyl. Do you mean 2 syringes dosed appropriately for this?
Yep, dosed appropriate, yep. Double dose of Strongyl, 2 tubes for a 1,000-pound horse. Quest, I would not overdose. Okay, ivermectin, I would maybe, if you got a 1,000-pound horse and you go to the 1,200, you're probably fine. Strongyl, very safe. Panicure, very, very safe. So if you're doing a double dose of Strongyl, no problem. Go to the end of the tube and load them up. But that should kill tapeworms, and Strongyl kills pinworms. So.
And then you were mentioning when you do your spring and fall vet checks on your routine clients and stuff, when you do that, you do the fecal, are you doing an internal exam?
Okay. No. I'm trying to get a fresh turd if I can. If they've been sitting around for a little while, they're still potentially useful. So, I mean, it doesn't have to be a brand new one. Yeah, I don't do that. But, you know, if the horses are rubbing their tails, a lot of times people are like, well, they have pinworms, they have worms. Maybe they do, maybe they don't. Because horses that rub their tails, a lot of people think if their sheaths are dirty, that's a problem. A lot of people have allergies. A lot of horses have allergies, and they'll rub their butts because they itch. And I think there are some horses that just do it because they're bored. So certainly the first thing is to worm them, make sure that that's taken care of, and then you have to start. Yes?
Is there a time, I know some people have told me, I've never read anything on any worm or check tube on what's the best time to worm, after feeding, before feeding, let them wait for an hour or 2 after feeding?
That's a good question. I don't worry about it. I just give it to them. That's a great question. I don't have an easy answer for you, and I suppose it might be different depending on the wormer, but I just give it to them. I try to make sure they don't have a bunch of hay in their mouth, and because they'll ball it up and spit it out. I gave one a couple of weeks ago, Panicure, and the next week the client left a note and said, can you do that again, because when I emptied the water bucket there, it was in the bottom of the water bucket. So, and again, back on the soapbox, we used to tube worm these horses, you know, and they didn't spit it out, and they didn't wipe it on their legs, and they didn't put it on the walls, but I haven't tube wormed a horse now for probably 2 or 3 years. So, and at a conference several years ago, they were talking about the resistance to these things, and they were, one of the drugs that we were commonly using causes a paralysis of the parasites. It doesn't kill them, and we would mix it with fenbendazole with the Panicure, and we would use that routinely in the spring through a stomach tube. And when they said, how many people here are still deworming, tube worming? And I was one of very few that raised my hand, and she was like, who in the right mind is still tube worming in this day and age when we have these wormers on the market and this stuff is available? And then at the end of the conversation, she said, well, we may have to go back to using this paralytic and fenbendazole in a combination because some of these wormers aren't. And I'm like, that's what we used in the spring every year through the stomach tube, you know, and they don't really have that on the market so much as, you know. So it's a frustrating situation just because it's been taken out of our hands. But as long as you guys are educated about it, it'll be fine. But you don't want to overworm. So, and then, yes.
Friend's horse spit most of it out. So she's very timid about it. It was ivermectin. Would you redo it, or would you wait, or would you do something else?
I'd probably do it again. I think it's pretty safe. I would probably just do it again. If she's really worried about it, give it a few days and give it again. Like I said, we're using the Panicure right now. So we on our wellness programs, if we're there 4 times a year, we just give them when we're there. On our twice a year program, we give the Panicure and then leave them an ivermectin, and then give the Strongid and leave them an ivermectin. So
And that's the one that's real safe. You don't have to.
Panicure and Strongid are both very, very safe. They're all safe if they're used appropriately. And they all, you know, to some extent work depending on your situation and, you know, what kind of resistance you may or may not have.
Any techniques on plunging it in?
No.
Horse that likes to spit?
Get the hay out of their mouth. Make sure there's nothing in their mouth as best you can. Get it in as far as you can and hold their head up and pray.
Can you squirt applesauce in? I've got one, and we just didn't.
I don't know why you couldn't.
Follow up with something sweeter.
Yeah, you certainly could. Yes.
Okay, we were always told after you get it squirted in, rub your throat, and maybe that'll make them swallow. Does it?
I always, I think you're hoping. You know, one of the things that I always do, not always, but occasionally if I have a client standing there, is I'll blow on their nose. And I'll be like, it's supposed to work with dogs, so, you know, maybe. And then they spit it down the front of you while you're blowing in their nose. Yeah, Quest Plus has praziquantel in it, so it'll kill tapeworms as well. Quest, I just save it, and that's our practice, and I just don't use it because it's one of the few it's the only thing we have left right now, so that works almost all the time. The vast majority of the time, it kills almost everything. So to me, it's golden. I keep it over here, and I don't use it unless I have to. That is not necessarily standard practice across the country. People use it all the time. And it's a good product. There's nothing wrong with the product, but I want something that I know is going to work. If I have resistance problems, I want to go to the Quest, and I know it's going to work, and I don't want to ruin it. So if they come up with something new, maybe we'll work the Quest into the program, and keep the new something. But right now, there's nothing exciting and new that I know of. So. We usually relook at 2 weeks. It's just a nice time period. If they're going to get reinfected, or if you have parasites that are not killed by the dewormer, you should be able to see something in a couple of weeks. So we usually do a 2-week recheck.
And then if it's still pretty good infestation at the 2-week, you'll do the same product?
No, I won't use the same product.
Oh, okay.
So like right now, if I've done Panicure on these guys, because the way it's set up, we get a fecal and do the wormer, okay? Because we're seeing them twice or 4 times a year. So I'll do the fecal, I'll get a wormer into them, and then if the fecal comes back positive, I'll check it in 2 weeks. Because if it comes back clean in 2 weeks, then my wormer worked and we're fine. If I check it in 2 weeks and it comes back positive, I'll usually tell them, use the ivermectin I left you for the summer or the winter time, and then if you want to recheck it, we will. If you want to assume this worked, that's a pretty good assumption, but it's nice to recheck them again, you know. So it just becomes more and more fecals. So, yes.
How much do you get then?
Of what? There's a dial on all of these that has a weight on it. So you can do pounds or kilograms depending on what they're teaching you in school nowadays. And just you can usually guesstimate. Or you can do a weight tape or do those fancy measurements online and figure out what they really weigh, but they're very safe. So if you overdose them, it should not be a problem. Yes.
There isn't a use by date on all of these products.
If there's a what, I'm
A
sorry.
use by date,
Yeah.
how comfortable, I mean, if you don't use it, if it says May 1st, you don't use it by May 1st, what's your sort of comfortable lapse?
That's a great question. What's the use by date? The born on date in beer is probably more important to me than that. But no, seriously, I will have clients use medications that are out of date. I don't think that at that time they're no longer potent. But if it's been a year, if it's been 6 months, I mean, you maybe assume that it's lost some potency. I don't know what the answer is, and I think every drug is going to be different. So if it's a month out of date, if it's two, I'll use it. I don't, you know, I won't, I'm not the type of guy that's going to make a client buy something new if they've got something in their tack trunk that'll work. So if it's just recently out of date, I would absolutely use it.
So you could go with a 3 to 6 month, knowing that it might not be as effective? Okay.
I will say we offer Zymectin Gold, and whenever you use our product, just make a comment about the outdating. As long as it's not open, you can exchange it 1-to-1 at no cost for Zymectin Gold and Zymectin. So there's no reason.
So
3 months prior to 3 months post outdating, you can bring it wherever and exchange it, no cost. So
Anybody that carries your product?
generally they call me and I deal with it, but we don't really see a lot of it going outdated because usually people buy it and they go home and use it.
They use it.
Right.
But
So Zymectin Gold is a similar product to the Equimax. It's got the ivermectin and praziquantel in it. Yeah, good product.